Hey everybody, Dennis here with Respiratory Sensei. We're on Egan's Chapter 7. What do you need to know for the purpose of the NBRC exam or for taking care of patients? Well, this chapter is a little bit nerdy. It's about the electronic medical record, also called the electronic health record or the EHR. It's got a couple advantages that you need to be aware of. So the key thing you need to know is that the electronic medical record should result in improved consistency and standardization of patient care. If a doctor's office sees the same record that the hospital does, then they know what's happening between those two organizations and they can provide better care to the patient. Now, there's a few other things that you need to be aware of. Because we're documenting electronically, then because everything we're doing, including the outcomes, the medications, all the interventions that we're doing, are in a database, we can look at not only what doctors have done across different spectrums, different patients, and even different healthcare providers, and see what has been effective. And this relates to the improvement of patient care, not only in a hospital, but also across the whole spectrum of the United States and even across the world. Now, there's another part of this chapter that just talks about electronics in general, the idea that as electronics advance, we're able to do better care. Good example of that would be a point-of-care ABG analysis machine. But that allows the respiratory therapist to make better and quicker decisions at bedside, and ultimately that can help care for the patient. Now, there's one more thing that the electronic medical record and the electronics do for us is that when physicians are putting in orders, it knows it can intelligently look at what they're ordering and prompt them to order different things. Just as an example, in our world, if a doctor wanted to order mucomist to be breathed in to thin secretions, the medical record can also just say, hey, doctor, do you also want to order albuterol? Because it also causes bronchoconstriction. If a doctor wants to just order a big bundle of things that prevents ventilator-associated pneumonia, then the computer can help prompt the doctor to do that. All these things should result in improved medical care of the patient. I'm Dennis from Respiratory Sensei. If you missed some of our other videos, be sure to go ahead and catch them and subscribe so you don't miss ones in the future.